every Thursday, such as this one, has been set aside majorly for healthy conversations. And when I say healthy conversations, every Thursday, in partnership with General Hospital Ikorodu, we have these conversations to help us stay on a know and how to take care of ourselves regarding our health. Today being the 20th day in the month of June, the year 2024, we would take a look at our healthy conversation from another angle entirely. And the reason for this is that yesterday being 19th of June happens to be the World Sickle Cell Day. Now, the World Sickle Cell Day is a day that is acknowledged all over the world by the World Health Organization in order to create this proper awareness to the public as regards this disease called sickle cell. You know, it's a blood disorder thing. But trust me, I am not a medical practitioner, and that is why we have the right man with us here in the studio from the Hematology Department, General Hospital Ikorodu, who will do justice to our discourse this morning on the issues as we focus on the World Sickle Cell Day. 19th of June every year has been set aside as the World Sickle Cell Day. And today we have with us in the studio Dr. Luro George from General Hospital Ikorodu, who would help us through having an understanding of when we say sickle cell, what exactly do we mean by sickle cell? Who are those that battle with this particular disease called sickle cell, and how can you even identify this disease called sickle cell? All of these and more we would have this discussion today on the issues. I am Opayemi Adebambo. I'll be your anchor for today, and my guest, Dr. Luro George, is already with us in the studio here. But then it is important for us to take this very short break. When we return, we get talking regarding the World Sickle Cell Day 2024. Good morning, Lagos. You're welcome back to the issues on IKD 106.1 FM, and this is how we do it every Thursdays through Fridays from 11 up until 12 p.m. Today we talk about the World Sickle Cell Day, and like I said during the starter, I said this is an awareness that goes all around. It is not just a Lagos thing alone. It is not just in Nigeria, not just in Africa, but all over the world. People living with sickle cell are humans, just like we are. And then it is important for us to know some factors about this disease called the sickle cell. At this point, I would like to turn on the microphone for my guest, Dr. Luro George from General Hospital Ikorodu. Good morning to you, doctor.
Good morning.
Thank you for joining us. It's good to have you in the studio.
It's a pleasure.
So today we're talking about the World Sickle Cell Day. And before we even start talking about the World Sickle Cell Day, I would first of all like you to help our listener out there to, understand, when I was introducing you being my guest, I said you're from the Hematology Department. I'd like for you to break that down. What is your capacity, your duty as a medical practitioner, especially with General Hospital Ikorodu currently?
All right. Like you mentioned, my name is Dr. Luro George. I'm a medical officer in Department of Hematology. Okay, the department actually shadow with the responsibility to care for this category of people, these special people. Because some people see it as the disadvantaged one, but we don't see it that way. We see them as the warriors. These are the people, the special people. Okay, so what we do here, basically we care for those of their concern, and then we also manage their their crisis.
Yeah. Thank you very much. You've heard the voice of my guest. I can tell you that this conversation will be very, very informative and educative. So for wherever you're listening from, please do well to, if there are questions at all, you can call us while the conversation is ongoing on our studio line 0904 081 1061 or 0904 082 1061 today while we talk about the World Sickle Cell Day. Now, you say that people living with sickle cell, like you have rightly said, and I agree, that they are people that, they are special.
Yes.
I totally agree with that. Talking about them being special, the first question I want to ask, help us to know when we say sickle cell, who are those living with sickle cell? What is sickle cell in itself?
Okay. Now, sickle cell disease is an inherited blood disorder that affects basically the hemoglobin. Hemoglobin is actually a protein. It's part of the component of blood. Okay, this hemoglobin is the one responsible with the function to transport oxygen from the lungs to other parts of the body. So when you are not saying sickle cell, you are talking about something clinically or medically that has affected the shape of the particular transporter, the hemoglobin. Okay, so
Okay, when you define it that way, in as much as you've used a lot of medical terms that might, that might want to scatter our medulla, but then the most important thing is that sickle cell persons are people that live with this blood disorder,
yes,
and they need to be cared for. Part of what we will talk about today, doctor, is to help people out there understand. There is this stigma. Sickle cell persons are always stigmatized.
yes,
People around them don't tend to see them as humans. And like you
yes,
said, they are even special humans. They are not just human. So you would help us through. We're hoping that at the end of this conversation, people would understand and come to love people that live with sickle cell, that they are human and they deserve to enjoy life just like every other normal person. Now, my next question, can you please explain the genetic basis, when we say the genetic basis of a sickle cell, how does it look like when you talk about the genetics? Sometimes some persons will tell you, okay, maybe because the mother is AS, the father is this. What are the genetic basis? Like, can you help us break it down so that we can understand?
okay. I would not like to bother my listener too much with medical terms,
Okay.
because when you are doing this particular head talk, you want to try as much as possible to ensure that your listener gets the basic information that are needed. So therefore, I might not go into how
it is
genetics
inherited.
inherited, but the basic things that everybody should know, because now this is just like shining light into some of the information they already had before, whether you are a sickle cell disease patient or you have a relative that fall into this category. So you have an idea that, oh, the reason why they come down with this particular disease is not because they were infected somewhere. No. We call it genetics, meaning that it's coming from a particular composition. Like, okay, mother is coming from the background of I'm talking about the genetics.
Yes.
It's AS and father is AS. Okay. So when we were in medical school, there's something they used to tell us then that, see, there's a way you cross match when you have AS and AS. Okay. If you cross match A, if A from the father, the B is the mother. Okay.
Yes.
So if you cross match A and this A, the mother or the parent can give birth to AA. Okay. So if this A move to the other S of the other group, so the child can come down with hemoglobin AS. So if they are now somehow in, I don't want to call it disadvantage this time, but if they are fortunate to now pick the S from the father and pick S from the mother, so they now come down with what we call hemoglobin SS. Okay. So that is where the concept of sickle cell disease come from. Okay.
Yes, thank you. Thank you for that clarification, Dr. George. Another thing that I would like to ask. You've already cleared the air. Is it okay to say that sickle cell is hereditary?
Yes.
It is.
Yes.
With the very beautiful explanation you have made,
yes.
It is most likely that it is hereditary. So
hereditary.
it's always important for us to know all of this blood group and
the genotype.
The genotype. Yeah, the genotype. Most importantly, the genotype. Now let's come down to some common symptoms.
Okay.
The reason for symptoms this time around is that we could have people that are not even aware. And because they do not know the symptoms, they just feel like, oh, okay, that is it. Ignorance could be another factor to that. But put us through, you've been in this profession for a very long time and you know the special people. Tell us some symptoms and complications, associated with sickle cell persons.
Okay. Let me start this way.
Okay.
Now, when you give birth, I'm talking about the newborn.
Okay.
Basically, or let me say clinically, there's no difference between a child born, I'm talking about at birth.
Okay.
a child born with sickle cell disease
Mm.
and those one without sickle cell disease.
There are no differences.
Yes, at birth.
Mm.
Okay?
Mm.
Especially when you have all those children below the age of 6 months.
Mm.
So there's something we call hemoglobin F at birth.
Okay.
So this hemoglobin F serves as a protective factor for that age group.
Mm.
So it's like you are saying this child is hemoglobin A. Do you understand?
Mm.
So that F protects them from coming down or presenting with symptoms.
Mm.
So the
it's
moment
like
you
it shields the symptoms, you can't see
yeah,
anything at that
you can't see
time.
at birth. You can't see. You can't see. But when you now have after 6 months,
Okay.
you begin to notice some early symptoms.
Mm.
Okay. And one of the things the mother noticed at this age group,
Mm.
from that age of 6 months,
Okay.
they begin to notice some kind of painful swelling of the digit of the hands.
Mm. Painful swelling.
Swelling, yes. When they say swelling, you know, babies cannot complain. They can't tell you they are in pain.
Exactly.
But there's a way we know that this one is in pain. And one of the ways to know is there's this kind of crying every time, especially when you are trying to press or touch that part of their body.
Mm.
So they give that information to both the doctors and the mother that they are in pain. So that's why we use the word painful. Because ordinarily somebody wants to ask the question that, oh, how do you know, doctor? How do you know
that is painful?
that is painful? So we
but
know
because they
by
can't
way
talk, the best way for them to express that is by crying.
Is by crying, yes.
So
yes,
it is best to say that it's painful.
It's painful. So when you notice that swelling on the dorsum of the hands and the foot, okay, we call it in our medical terms, we call it hand-foot syndrome. Okay? So when the mother noticed that, the mother was like, oh, doctor, I noticed something very strange in this baby. See the hand, see the dorsum of the hands and the foot, see the swelling. So from there, we begin to think in that direction that hope this child is not a child with sickle cell disease. So perhaps the doctor that saw the mother before, they don't have the privilege to ask or forgot to ask the mother the genotype of the mother. At that point, we begin to question, what is the genotype?
What is the genotype?
What is your genotype? What is your husband's genotype? Okay? So the other thing that we also notice at that age group between 6 months and 2 years, there's something we call failure to thrive.
Failure to thrive.
To thrive.
Please tell us.
Okay. Now, this failure to thrive, you know, our mother believed that when the child grew to a level, it's expected that the child to start crawling. Okay? So when you crawl, the word thrive there, in common time, when you want to look at it in common times, thrive is like you are successful. You are achieving progress. You are making progress. You are achieving those milestones. Do you understand?
Yes.
So, but this age group, they don't achieve this. Okay? Some they don't achieve it early. It's not as if they won't still achieve.
But they have a slow growth.
They have a slow growth. Okay? So that is another one. So, and another thing that we also notice at that age group, or the mother can also complain of, is this fever. They start complaining that, oh, this child is running temperature. This is running temperature. So because of their immunity, they also present with features suggestive of infection or sepsis. Okay? So now when we now leave that age group, the other group that every parent should also watch out for is the age above 2.
Above 2.
Above 2. Okay? Apart from the one I've mentioned earlier, there's this particular terms that we use in our department, in our field. We said sickle cell habitus. Okay? That sickle cell habitus is talking about, one, when you look at this child, you look at the forehead, there's this prominent forehead. Okay? We call it frontal bossing in medical term. Okay? So like when you're supposed to have like this part of the forehead flatten, come out in an unusual way. Okay? You see that prominent part of that forehead. So it's common with people living with sickle cell disease. That is one of the habitus of the sickle cell. And the other thing is the mother begins to notice that, oh, the child is growing, but the limbs, what I mean by limbs, what some of you popularly call hands and leg. You generalize it, but in our own field, we have them as limbs because it's not only hands that we have in whether you're talking about the upper
or the lower.
We have the hand, we have the forearm. I'm talking about the upper.
Yeah.
Then when you come down to the lower, we have the thigh, we have the leg.
True.
So we don't use those times. We use generally these extremities. Okay, the upper and the lower. So the mother begins to notice that this part of the body is becoming thinner and longer, like a form of waist, muscle waist. Do you understand? The child is growing in other side of the body, but the limbs are thin and longer. Okay, so when you complain, when you have this kind of symptom, as a doctor, we begin to quickly put our one or two information together clinically and begins to look at this patient from that angle that this person can be a sickle cell disease patient. Okay. So apart from this, there's other features that they come out with. I'm still in that sickle cell habitus.
Yes.
Okay. The other thing is abdominal protuberance.
Please bring that down.
Okay. I'm very sorry if
no, it's fine. I just want the people to benefit.
Yeah. So abdominal protuberance. This time, in the normal times, or let me say in the street times, when you touch this part of your body, you say you are touching your stomach. This is not what we call stomach. We call it abdomen. Okay? We call it abdomen. It's not stomach. Stomach is one of the structures inside that you cannot see with your eye.
So the stomach is internal.
It's internal. Okay? The one you touch outside, the one you can see, you can feel, is what we call abdomen. Okay? So what you have in sickle cell, you have this prominent abdomen, unusual one. Normally, if you are in particular age group, you are expected to have, you have flat tummy, as you say, or you have full tummy. But this your own, don't forget, the limbs are thin and long. This part of their body now become protrude. It's form of swelling. Do you understand? So when we see this, it's a pointer that this is a sickle cell disease.
Now, I want you to tell us the importance of newborn screening, which I know is something people always do, but not all the time people take that into cognizance. So I want to ask the question, what is the importance of newborn screening to, the diagnosis or discovering if a child is living with this sickle cell disease?
The diagnosis for that age group, I'm talking for especially in this part of the world, Africa, is clinical. 80% of it is clinical. Of course, we have laboratory. Some other things you can run, you have some blood tests, though not for those age of less than 6 months. Okay. The one of that, whether old or young, the first thing is the clinical. When you say clinical, what are the things you can see? Okay. You are looking at the symptoms. Symptom is simply what the mother or the patient complain of. Okay. Then now the signs are the one coming from the doctors. Okay. You are looking at what are the signs that give it out to sickle cell disease. Okay. Signs are those, some of this stuff that I've mentioned. You can mention from the head to toe. You have what you see on the face, like the frontal bossing, this prominent forehead.
Frontal bossing, is it okay to call it forehead that we all commonly, is that okay? Because you've told us already that stomach is not stomach. So the frontal bossing, like you said, is it the one we call forehead?
Yes, it's forehead. Okay. Use forehead. So everybody will understand that.
Yeah.
So it's forehead.
Now let's look at some myths now. I want you to help us, most especially, the essence for the World Sickle Cell Day is so that people will be aware that people living with this disease called sickle cell, they are also human, and they are special human, not just the regular kind of human. So you would help us through that awareness, and most importantly, the challenges that they face as a person living with sickle cell. But I want us to just quickly, if possible, in 5 minutes, to talk about some of this assumed myths attached to sickle cell diseases. You know, some will tell you that I remember a very long time ago where a particular father disagreed, you know, and he had to come down to our school then as children that we are, that don't call my child sickle cell. This is how we look like. You know, there is this shape and look like you have described. But the man refused to agree, even though a lot of people can still tell. He's saying, no, that is how we look like in our family. That is how we grow. That could be a kind of myth. First, that I want to ask is, as regards age, there is this belief, or do I say fallacy, that people living with sickle cell disease, there's a particular age they can live to, and after that age, they are no more. Some will tell you that when you live to this particular age and you live above it, then you are no longer a sickle cell patient. And, you know, I don't know if you've heard all of these things.
Yes.
Please, let's start with that first. Talking about age, is it true that a sickle cell disease person has a time frame to live?
That is not true.
It's a fallacy.
It's a fallacy.
Please clear the air.
It's a pure fallacy. Okay? It's one of the problems that this group of people have. Okay? Now, when you're talking about the complication of sickle cell disease, there is this part of that complication that we take very seriously.
Okay.
And that's what we call psychosocial complication. Psychosocial complication. Okay? Now, you know, at times, when people come down with disease, people don't easily die of those diseases, but they die of some of the things, they die as a result of stigmatization.
True. When people stigmatize them,
When people
stigmatization, yes.
stigmatize them.
Yes.
Okay? So, for example, now, in our clinic,
Okay.
we don't call them sickle cell patients.
Okay. What do you call them?
We call them warriors.
Warriors.
Yes, we don't call them
Beautiful.
sickle cell
Beautiful.
patients. Okay, because for a very long time, people have stigmatized that group of people. When you hear sickle cell, there's this other thought that come with it. Oh, these are the people that have a very short lifespan.
And it affects them psychologically.
And it affects them psychologically.
It drains them. That alone can take them away.
In fact, that is why some of them, when I'm talking about for the older one, when they start, because there's this symptom and sign common with them. That is jaundice. They have this yellowiness of the eye. Okay, when they now have it persistent, there's this worry and fear that come with it. Hope I'm not going to die soon.
That is where that myths come from, that they usually die at a particular age.
At that particular age. So those kind of symptoms remind them of some of the wrong information they've gathered a very long time from their friend, the society they are.
Even family.
Even family. So some of them will be like, oh, doctor, hope I'm going to live beyond so age group. But I used to give them this. I said, see, if you look around you, don't travel far. I have some instances, some people that you can look and say, oh, this is sickle cell patient, sickle cell being, and is living well. Look at this warrior. There's this popular governor, former governor in this country, former minister in this country, is HBSS. He served this country as minister, served this country in the capacity as a governor. I don't want to mention his name.
And he lived with sickle cell.
And lived with sickle cell.
And he's still living.
And he's still living. So we have instances, we have a lot of people in that group that can live up to 50, 60, 70, 80, depending on how you follow the do's and the don'ts of that plan. I'm talking about the treatment, the follow-up, okay, or how to manage that particular genotype.
Exactly.
Because some people don't understand that when you tell them to, like, oh, take your drug regularly, visit hospital regularly, when you have this, visit hospital, they feel like, oh, what is this person saying? You mean I should be using my entire life to be visiting hospital to be doing this? But I keep reminding them, I say, who is that person in this world that doesn't have one problem or the other?
Everybody does, actually.
Everybody. Everybody. There are some people that have diabetes. There are some people that live with hypertension. There are some people that live with retroviral disease. They are human beings. You are just fortunate to be in this group, in this category. Okay? And when you are there, don't see it as, oh, I am in the group of people that doesn't live long or the disadvantaged one. You don't do that. Because the moment you do that, indirectly, you have conquered yourself mentally. You have bring yourself down. Don't forget, people with sickle cell disease, they have problem with immunity. They have very low immunity.
Yeah, their self-esteem is low.
So it's low.
Already.
So if you are now trying to help society to bring yourself down, you'll be the person that will suffer the consequences.
Let's talk about another one. Thank you, Dr. Lulu. Still talking on this particular day that has been set aside by the World Health Organization, 19th of June. Every year is the World Sickle Cell Day. You can join this conversation if at all you have questions as regards, everything that our doctor has been talking about, or if perhaps you're confused and you want to find out more information, you can call the studio line 0904081161 or 0904082161. Still talking about fallacies or myths. I'd like for you to clear the air as regards another belief of our people when they will tell you that sickle cell disease persons are from a particular region, a particular town, a particular ethnic group. They believe that no, it cannot happen to some particular people that are living healthy or wealthy or strong. So help us know, is it true that sickle cell is always kind of, some kind of people, some kind of environment, or some kind of family, or is something that could happen to anybody, anywhere?
Should I say this one is like one of the highest fallacy in that genetics is not about region. Okay? Don't forget when we started, I said it's an inherited blood disorder. Meaning that if you are SS or AS, if you are AS, my father is AS, I can be SS. Okay? My father genotype has nothing to do with the region he came from.
True.
Your father genotype has nothing to do with region. Okay? So it's fallacy.
It's another fallacy.
It's another fallacy.
Okay.
In fact, it's
the biggest fallacy.
It's the biggest fallacy.
Okay, let's see if this third and last one, leaving that particular part so that we can proceed to the management of sickle cell disease. Let's hope this is also another big fallacy because I like the fact that you're saying there are fallacies that will put the mind of a lot of people at rest. Is it also a fallacy that finance, as a sickle cell person, is always a major problem? The treatment and all of that, they say it is quite very expensive, to live with sickle cell and go through the treatment, medications, and all of that, that it could be quite expensive. Is that also a fallacy?
This one
is not a fallacy.
I will not say it's a fallacy, and I will not say it's not a fallacy. But let me break it down this way.
Yes, please do.
Okay. We say the best form of treatment is prevention.
The best form of treatment is prevention.
Okay. Now, the money you use to prevent is far, far smaller than the money you use to manage a particular disease. So that's why I said I will not say it's a fallacy, and I will not say it's not a fallacy. Depending at angle at which you are looking at this. Number one, if you are talking about preventing complication, preventing serious complication in sickle cell disease, the money you spend is small. In fact, it's not up to the money you used to buy some of these funny things that people buy out there. There are some of those drugs that by the time you pack it together, the drugs that will take you for like 2 months is not up to 3,000 naira. What are the
2 months?
For 2 months. What are the common drugs that you have in HBSS to prevent starting complication of that sickle cell disease? Folic acid. How much is folic acid?
Quite very affordable.
Vitamin C, Bico, vitamin Bico. How much? Small. This prophylactic anti-malaria called Proguanil, small. But when you feel that drug should not be part of the things you should live by, you might end up having this issue of financial crisis when it comes to managing complication.
When it comes bogus, and there are a lot of issues,
serious complication. Do you understand?
Yeah.
So if you can prevent, like I always say that prevention is in 3 categories.
Okay.
Okay. For the parents that are not in this group yet, okay, you can prevent that from happening. Stay away from your AS, stay away from AS.
So this is another way to let people know that it's important before you even get married to that
Marry,
particular person.
yes.
Be sure.
So be sure you know the genotype of your spouse, the person you intend to marry, because it's very important. That's where the issue of genetic counseling come into it, though we are still going to discuss about that when
Yes.
we get to treatment and management.
Yes.
Okay. So if you can prevent that, do that. So the second part of that prevention is all those small drugs that we ask you to buy. If you can buy it, there are a lot of things you can prevent. For example, somebody asks you to buy folic acid, you buy it, the person will not be short of blood. Okay? You have something to make up for what you don't have naturally. And that's why we call it exogenous. They are also form of food if you want to have it. So, form of exogenous. Some people will tell you when they come to clinic, they say, "Doctor, I'm tired of taking my drugs." I do ask them one question. I say, "But I've not seen any of you come to this clinic and tell me that, doctor, I'm tired of eating food."
Because you are never tired of eating.
You can never be
so
tired.
You should not be tired
You
of
should not be
drugs.
tired because drug is also a form of food for that group of people. Okay? You are not having enough blood and somebody is giving you something to boost that blood. You should be happy. You should take it with joy.
Thank you very much. Our doctor still talking about the World Sickle Cell Day that happens to be 19th of June, yesterday precisely. Now, let's get this conversation to the peak of it. This is the most sensitive part. We're going to talk about the treatment and the management of sickle cell disease. But let me quickly ask, what are some challenges that are being faced by this patient living with sickle cell disease? What do I mean? You have been with these people. You are always with them for years. You'll be more conversant with some of the challenges that they face as regards being a sickle cell person. Put us through, help us, have an understanding of how it feels like for them. They come to you and tell you, doctor this, doctor that. What are some of these challenges they face as a sickle cell person, patient?
The commonest one is what the society thinks about them. The commonest one. When they come to clinic, say, "Doc, hope these people are not tired of seeing my face every time. Today, I'm here because of pain. Tomorrow, I'm here because of pain. Next tomorrow, I'm here because of pain." So it begins to think, they are not thinking about their own heads. They are thinking about the society.
What the society is saying.
What society is saying about me. Some of them, even when they are going at times, they still want to delay a bit and see if there will be any conversation behind the door. So they want to see there's this person that each time he's going to say, "Doc," and I say, "Hope I'm not bothering too much." I say, number one, no, I am doing my job. That's first one. I'm happy that I'm doing this job because our job, you are happy that you are making a life better. You are happy because you are putting a smile on a face. You are happy because you are helping somebody to appreciate life better. So it shouldn't be a burden from our angle. So when you are going, I say, "Doc, hope I'm not bothering too much." I say, no. In fact, I will also go as far as like, "Oh, see, you have your periodic clinics. For example, if you visit clinic this week, you can be given 6 weeks appointment." I tell them, I say, "See, if you have crisis close to the day of hematology clinic, please come."
Without waiting for
you don't need to wait.
Specific schedule date.
Yes, you need to come because this is why we are here. And government is paying us for this particular job. So come. Then for some, because clinics is not every day. Okay. There are some days that you don't have doctors in your clinic. That does not mean you don't have doctors in another arm of that hospital. For example, accident and emergency. If you have pain, you have issues, you have complication, go to those units and have yourself treated.
They are still medical practitioners. They will attend to you.
They will attend to you. At least for those basic things that you need. One, they will relieve you because one of the hallmarks of sickle cell is that pain. Pain. At least get there because some of them, they must have tried at home, taking analgesic, some pain relief, do some kind of small thing you gave them as instruction when they have pain. You try it and this thing is not working. Come to hospital, go to accident and emergency, complain to doctors, have this pain relief.
Mm.
Okay?
Mm.
So you don't need to wait for your clinic.
Mm. Thank you so very much. Now let's talk about another set of people entirely. Those are people not living with sickle cell, but then they have those people around them. They are one of the reasons why these people have low self-esteem. Not all of them, but few of them that will just stigmatize and bring them low and all of that. So tell us, with what you've seen and experienced, what are the challenges the people around them also face? People like the mother who sometimes brings them to the hospital, the father who financially supports, the brother and the sister who will need to always be there for them when the crisis occur. What are some of the challenges that they also face, as somebody helping, this person living with sickle cell? Can you tell us some of the challenges they face too?
Um, One, some of them face with this challenge of non-drug compliance.
Mm, mm,
You are not the one buying the drug. Somebody is paying for this,
mm,
yet you are not taking the drugs.
mm,
So those set of people, it will get to a level that they become tired.
mm,
I've seen some very small individuals coming to hospital without their parents. They'll be like, where's your parent? Say, Mom is tired of coming to hospital every time.
You've seen something like that
Yeah,
before?
yes.
The
I see
patient say,
a
Mommy
lot.
is tired of coming.
Yes, he's tired of coming.
Wow.
So I was like, why is she tired of coming?
Mm,
Why is she tired of coming? And I said, one time he said I should do this, I should take my drug. I did not take my drug,
mm,
and this and this and that and that. I said, see, this is your life.
mm,
You know, some of them are very smart. They have read some things and understand the problems. They know that this thing is coming from their parents.
mm,
So even when their parent is trying to like encourage them that, see, you are a warrior, you can do this, you can achieve this, you can achieve
mm.
that. There's this second part of them like,
You put me into
you
this.
put me into this.
Even though they can't say it out in their
Yes,
minds.
you put me into this.
Mm.
So because you put them into this, they don't care the stress you go through. So
You
at times
face it.
you face, yes,
Mm.
you ask them to take their medication, their drugs. Some of them take today, tomorrow they won't. Next
Mm.
tomorrow they won't.
Mm.
But the day they have crisis, you
Mm.
take them to hospital. So it will not get to a level in their life, the mother or the father will become tired of visiting hospital every time.
Mm.
So they'll tell them, oh, you are now an adult,
Mm.
even though they are not real adults, so to say. Say, go to hospital
Mm.
yourself. In fact, I have one recently. That one, the PCV, the pack cell, was very low. I think about 18%.
Mm.
So I need to transfuse. I need to give this boy blood. I was
Mm.
like, where is your mom? Because I know the process, you can't go through the process.
Mm.
Process of getting blood, process of getting this or that. I said, where is your mom? I said, Doc, don't worry about my mom.
Mm.
Tell me I will do it myself.
You can imagine.
I said, how much do you have in your account? So, this is not like
Mm.
doctor and your patient. So,
Mm.
so you are free with them. They are happy that you are
Mm.
talking to them. I said, doctor, how much do you have in your account? I said, doctor, I don't have, but just tell me I know how to go about it. I said, don't worry. Give me the phone number of your parents.
Mm.
I can call them and discuss. Because some of them, when they are tired, you need to encourage the mother that you don't need to be tired.
Mm.
So it's just about information. Give right information at the appropriate time.
Mm.
These people will follow.
Mm.
And don't do it with double mind.
Mm.
Because these people, they are not only reading the information you are giving,
Mm.
they are also reading your body language too to some things.
Mm.
You know, when you take a child to hospital and doctor will be like, oh, go and get this particular drug.
Mm.
Some of them, because they don't really value that child,
Mm.
there's this kind of I don't care attitude.
Mm.
So they don't feel
They don't deem it fit as
fit
necessary.
You imagine somebody that you came to hospital and doctor are like, see, the PCV is low, your child will need blood. They say, no, doctor, because of my religious belief, don't give this boy blood.
Mm.
And you know this boy, his life is dependent of that particular blood.
Mm.
This boy need this blood. You say, no, don't give it. All because you are scheming for the boy to die.
Mm.
Sorry to put it on air this way, but I think we need to do better on that area so that.
Yeah.
So because you see that this child is not important child.
Mm.
So and they too they know.
Mm.
They know. That's why some of them when they are looking at when you give some of them, you give this kind of gesture and things. You're like, don't do that.
Mm.
Don't do that. You don't do that.
Mm.
We understand when they communicate in that way, when they give that kind of information.
Mm.
Don't do that.
Mm.
Mom, then the mother will tell the mother or the father, go to lab, get this done, get this done. I need to transfuse this boy right away. You put pressure, you encourage, you advise them, you tell them what this boy can still achieve, even with this genotype. Some of them at the end of the day, you say, oh, doc, okay, let me go and get it done, and they will do it.
I must say, you doctors, especially from the hematology department, you're doing so much, and definitely your reward is just right there, waiting in stock for you all. So let's talk about. We have just 10 more minutes. I want to thank you very much for being with us all through. I enjoy every bit of this conversation from you, Dr. Luro. Now let's use the remaining 10 minutes. Let's utilize it on talking about the treatment and management. This is like the most important of this conversation. How is the treatment like? What are the current treatment, let's say options, that are available for individuals living with this sickle cell disease?
Okay. Now, when you are talking about treatment,
yes, and how it can be managed.
Yes, we started from symptoms. No, we started from the definition.
Yes,
the meaning of sickle cell.
Yes.
Okay.
Yes.
Then we move to symptoms.
Exactly.
Those symptoms, signs, and those tests are part of the management. Do you understand? So they are part of the management. So now, when you're talking about treatment, the best form of treatment or management, like I said before, is prevention. Okay?
Yes.
This prevention, one, you want to prevent complication of this disease. And the other one, you want to now treat. You want to manage those complications that has already set in.
Is there already?
Is there
How
already?
Do we manage
How
it
do
now?
we manage it? So now let's start from prevention of that complication. The first thing you do when it comes to the prevention of complication is you need to avoid what we call triggers.
Triggers?
Yes. Triggers are those things that cause them to have pain. Triggers are those things that make their blood go down. I'm trying to speak in a very mind term.
Yes.
Okay?
Yes.
So these are the triggers. Okay? Now you need to avoid those triggers. One of the triggers that is common with hemoglobin excess is extreme cold.
Extreme cold.
Extreme cold. So if you have a child with sickle cell disease,
yes,
do all you can to prevent them from playing under rain. What that does in the system is it causes shrinking, causes narrowing of the blood vessel. You know, the blood travel through those vessels.
Yes.
So when they are in cold, it's shrinking, narrow those blood vessels.
So it restricts the flow.
The flow, yes. And another thing is it makes the blood clot. And the moment, don't forget that we call them sickle cell. For those of you that are farmer, you will understand this part very well. When they saw something is sickle, think maybe they call it or I mean something like that. So you imagine the shape, okay? You have a deformed hemoglobin travel through the blood vessel. Don't forget the red cells. They are ordinarily round and flexible, so they can easily travel through the vessel. But in their own case, it's kind of deformed. Do you understand? So it's deformed. So there's problem in traveling. It can't flow very well. It's not smooth. It's not smooth. So you now imagine somebody trying to like make the road now narrower than usual.
Something that originally is not even favorable.
It's not favorable.
Now getting more narrower.
So you are now exposing this particular flow to something that constricts, that reduce the space of that flow. Do you understand?
Yes.
So
yes,
now this extreme cold should be avoided because it's one of the trigger of that crisis. Then the other thing apart from this is extreme heat.
Extreme cold, extreme
heat. Why is everything about extreme? It's extreme because it's extreme. One, when you say extreme heat, what does heat do? When you are in a place that is not ventilated, you begin to sweat. So when you sweat, you lose blood. You lose water.
Sweat, yes.
You sweat, water. You lose water. Okay? So when you lose water, you don't have enough in your body ordinarily. So you are not losing more. So there's something we call in medical term dehydration. So dehydration setting. One of the triggers of that sickle cell crisis is dehydration.
When you are dehydrated.
When you are dehydrated.
The crisis
So that is why we tell them that, see, apart from this high altitude, make sure you don't do strenuous exercise. Because strenuous exercise, you know, during that exercise, you hyperventilate. You breathe with your mouth. You hyperventilate. You lose fluid in that process too. So when you lose fluid, you become dehydrated, and sickle cell does not tolerate dehydration. So that's another trigger. So another trigger from that angle is infection. Infection. Okay. So infection is talking about when some of you say, you know, infection can come from different way. Can be maybe from where you urinate through, that is urinary tract side. It can come through wound, can come through different channels. Okay. So now you avoid this trigger because infection is also part of this trigger. Then I'm still talking about that prevention.
Yes.
So the other thing is you have some routine drugs that doctor prescribe each time you visit clinic, most especially when you are not in crisis. For example, folic acid. You need to take it as part of your daily food. You take your Bico as part of your daily food, and because their immunity is low, we don't want them to come down with malaria. So you give them what we call proguanil, that is prophylactic anti-malaria. Okay. So we don't wait until when they have malaria. So we give them something that will prevent
the malaria
from coming. So these are other things we do. Okay. So now this will take us to the other part.
Yeah.
Okay. Before that, your water is also very important in sickle cell. I said prevention. I talked about the trigger. I talked about your routine drugs.
Exactly.
Fluid. You need to take your water regularly. You need to take your water regularly because you cannot tolerate, your system, your genotype cannot tolerate dehydration. Therefore, you need to take your water. Some of them, we encourage them, get a bottled water. Not about, even some rich people abroad, when you see all this, you see US president, when he's giving speech, you see water. It's not a disease. They are carrying bottled water. I see somebody will say, oh, he's having disease, that's why he's carrying. No. It's African mentality. It's African mentality. You don't need to see it that way. Carry your water, take it. The rich people do, even the poor. Water is very therapeutic. So you take
affordable.
It's affordable. 20 naira, 50 naira, you have 3. And you can't finish 3 in 1 minute. So the other part, because of time, is the complication.
Exactly.
Some of them, because their blood level is low, though they might not have that information, but what they notice most of the time is this extreme body weakness. They feel, I'm tired easily, getting tired. When they come to hospital, you ask them to do full blood count or PCV. You notice that, oh, the PCV is low. Okay? So if you can have this at the back of your mind, that the hallmark, the pain and the anemia. Okay? I don't want to bother you with the different crises that they have. So that pain is what we generally call a vaso-occlusive crisis.
Okay.
Vaso-occlusive crisis.
Dr. George Luro, I want to thank you so very much. We still have a lot to talk about. As a matter of fact, for me, I think we've done, just little of the plenty that we could have talked about, but time will not permit us to proceed. So this is how we will do it. It's most likely you will still come back because I love every bit of our conversation. What will be your parting words, your advice to, let's strike a balance with 2 persons now. So we'll use a stone to kill 2 birds. What will be your parting words to people living with sickle cell disease right now, listening to you at this time? Okay. That is the reason why you are even here, And then what will be your advice to people taking care of those living with sickle cell?
Let me start with people with sickle cell disease. That your genotype is SS does not make you less important. That your genotype is SS does not make other people more important than you do. Okay? They are fortunate to have AA and you are fortunate to have SS. It's still genotype. Okay? What come with crisis does not come with crisis, but it does not reduce anything. I'll tell you, you're a warrior. You can achieve every bit of your plan if you can play according to the rule of your genotypes. What your genotypes entails, what your genotype wants to do per time. If you can follow it and you can follow the instruction, there's no problem. And though for those fallacy, erroneous information you've had for a very long time, I want to tell you it's nothing but fallacy. You need to discard it. You can live up to 100 years. There's no age bracket for the time, or let me say, there's no limit to the number of years you have to spend on this earth. Genotype does not reduce it. If you know how to do it, I'll just give you an example.
Exactly.
If somebody can rule a particular state for 8 years as governor and serve as minister and is still alive at the moment, I believe you can cross that line too. So it's about information. It's about you do the right thing at the right time.
Please talk to people that are actually helping them,
So
to go through this.
For people helping them,
yes,
2 things you must understand. We call it disease. We said sickle cell disease. It's not an infection. We should move away from all those kind of informations that does not have clinical basis. Some of us, or let me say some of you, you've lived with it for a very long time, and you're becoming somehow more discouraged because you feel that these people, no matter how much you spend on them, they will still die. They are not going to die. You need to help them
not to die.
Not to die. So if somebody is giving you that information that they will soon die, you need to help them not to die. It's not only doctor that are shadowed with that responsibility to keep this life. You have a role to play in making sure that these people live beyond what people put as the age limits. You need to help them. And one of the way to help them, if you have money, give. So if there's another way that you feel you can help these people, please do.
Thank you very much, Dr. George. Remember one thing for certain: if you're AA, you are not above debt. AS, you are not above debt. SS are not the only persons that you think they will die with the common assumptions. They can live 100 years or more, just like our doctor has rightly said. Treat them as humans that we all are, and remember that they are warriors. That is the word from Dr. George Luru. Thank you so very much for your time. It's a pleasure having you in the studio. I am Okoyemi Adebambo. Until next week, Thursday, please stay healthy. IKD 106.1 FM. For now, we're signing out. Thank you.